Hi, it's Dr. Smith again. Millions of Americans suffer from reflux and heartburn. It's estimated that 20 to 30% of adult Americans have some type of reflux or heartburn symptom on a weekly basis. Antacids and medications are usually the most common way to treat this problem, but here's the thing, they may not be the most healthy way to treat this problem. You see, when you eat something, the parietal cells in the stomach release a very strong acid called hydrochloric acid. This acid does two things. First thing it does is it prepares the food to be digested and absorbed by the small and large intestines. Without this preparation by the acid in the stomach, the rest of the digestive system will not be able to do its job as well as it should. Secondly, and perhaps more importantly, this acid breaks down proteins, enables your body to absorb minerals like calcium and magnesium, and it makes it possible for your body to absorb vitamin B12, which is an essential vitamin. Your body can't make it. We need to get it in the foods that we eat. Now, without proper amounts of stomach acid, none of these things are going to happen, and a person's health will suffer. See, then you get a person who has heartburn or reflux. In these cases, what happens is that the acid escapes from the stomach and travels up the esophagus, causing the heartburn or reflux symptoms. The common medical approach to handling this problem is to prescribe antacids to neutralize the acid, or to give medications like Prilosec, Nexium, or Prevacid to prevent your stomach from producing as much acid as it should. Now, these medications can help the symptoms, but in the long run, they're going to mess up your digestive system royally. Now, how come you don't have any energy? It's because you don't have enough stomach acid to absorb vitamin B12. How come you have osteoporosis? Maybe it has something to do with the fact that you don't have enough stomach acid to absorb the calcium in your foods or even in the supplements that you're taking. Why do you feel weak? Maybe it's because you don't have enough stomach acid to digest and absorb the proteins that build muscle. Many things like this, along these lines, can happen if you don't have the proper amounts of stomach acid. I'm not saying that you should never ever take any of these medications. They can be helpful in the short term to help alleviate your symptoms, but they are not going to fix anything. They are not going to fix the problems with your stomach acid. You just won't feel the heartburn. Now, natural solutions, on the other hand, to handling reflux and heartburn are designed to work to make sure that you have the right amount of acid in your stomach. So that way you don't get the symptoms, but also your digestion and absorption work the way they're supposed to work. So in the next video that we're going to do, I'm going to go over the natural solution that's worked in 80% or more of my patients who have had heartburn and reflux.